Good morning, everyone. Last week was a busy one for the City of Decatur as we discussed our mask ordinance and traced the increase of cases locally and statewide. This week, we're joined by several guests who will give us the latest updates and explain what the mask ordinance means for us in Decatur. Our guest today, we are pleased to have with us for the first time our new president at Decatur Morgan Hospital, Kelly Powers. Kelly, we're thrilled to have you with us today, and thank you for all that you and your staff are doing to treat our community members and keep us well.
Thank you.
Okay? And then, of course, we have with us Judy Smith with the Alabama Department of Public Health. Judy is the administrator for the Northern District, and Judy is back to give us the latest information from the Alabama Department of Public Health. And then today we'll be joined by Decatur Police Chief Nate Allen. Chief Allen has served as a lead incident commander for our COVID-19 response from the beginning, and today he'll explain how our mask ordinance will be enforced in Decatur. Current Morgan County COVID-19 cases were at 1,338, which means an increase by 21% in the past week. I will note that yesterday the positive test, we were 69. That was the highest to date for Morgan County. So with that, personal responsibility still remains vital. This thing is not going away. We all have to do our part. We must socially distance, wear a face mask, wash your hands, and disinfect. It is through the completion of these crucial steps that we can keep ourselves well, keep our families healthy, and sustain our local economy. We're happy to serve you here at City Hall. If you can, please reach out to the department that you have to do business with first by call or email. As many trips can be saved by that type of correspondence. I also want to encourage you to, if you have not done so, to complete your census at my2020census.gov. That's my2020census.gov. You know, churches, our chamber, a lot of folks are staying in touch with residents, members, and things of that nature by phone. And we can do that as a community as well. So I want to encourage you to call someone in your neighborhood, especially an elderly person, and check on them today. Also, if you have any questions, remember that you can reach out to your city council representative or me. Our information is available on our website at DecaturAlabamaUSA.com. As always, I want to encourage you to support our small business in whichever capacity you can. I'm thrilled to say that our economy is doing better than we expected in light of COVID. And that's a very encouraging thing, and it's because of you. So thank you for how you're doing business here in Decatur. Both garbage and recycling are operating as normal. And then I want to note, before I turn this over to Kelly, that we mourn with Decatur in the loss of a beloved resident and businessman, Barrett Shelton Jr., the publisher of the Decatur Daily. We send our deepest condolences for peace and comfort for his family and the Decatur Daily family. So with that, now I will turn this over to Kelly. Kelly, it's really good to have you with us.
Thank you. Thank you. It's glad to be here, Mayor. Thank you so much. I want to talk this morning first about the masking ordinance. And I would like to say that on behalf of the hospitals, we really hope that all the other communities will take this and also adopt this ordinance. Not only all the community, local governments, and other community leaders, because this is not about each person individually, it's about our community coming together. As you and I spoke, we have a lot of people that travel in to work here at the Arsenal and other places, and we want to make sure that we keep all of our community, all of Alabama safe.
Yes.
I think one thing that people forget sometimes is you're wearing a mask to protect other people. And the thing is, you never know when you meet someone what kind of health condition they may have, because you don't know about them. Personally, I have a daughter who's pregnant, a brother who has cancer, and a father that's 82 years old. So I really don't want to get COVID-19 myself, because I don't want to have to share that with them. And so I try to wear a mask wherever I go, socially distance, really try to clean everything as possible. But I really want to stress this morning that we need to do that in all of our communities, everywhere, so we keep everybody safe. At the hospital, Currently, I wanted to give you the numbers on where we are today. We do have capacity to take patients. I don't want anybody to think they should come to the hospital if they need to. We're taking every precaution we can to make sure that we do not spread COVID-19 to anybody. All of our surgeries are safe. And with that, we don't want to overwhelm the hospitals. So at the point where the elderly people get this, or the immunocompromised people, and need to come to the hospital, please come. I don't want people to not do that. I want to get that message out. This morning at Decatur, we have a total of 26 inpatients with COVID-19. We have 10 patients who are presumptive positive waiting on results. Of the 26, we have 4 in our ICU and 1 on the ventilator. That is down a little bit from the week before. We were trending up, but as we see the community and the state trend up, we will probably trend back up again this week or next week as we get more positives. The other thing I wanted to say was thanks to you, the City of Decatur, the police department, the fire department, everybody that has helped us, churches, business leaders throughout the community with this. This is a total effort by everyone. And thanks to all of our frontline staff, the nurses, the techs, the housekeepers, everybody, I couldn't name them all, the physicians that help with this. A lot of lives have been saved. We've lost some, and we mourn for those people and those families through this, but we've done a great job in saving people. And their Remdesivir, the new drug that's out, we're seeing positive results from that, and a lot of good things from that. So I just wanted to leave you with all of that.
Good.
Other things?
Okay.
I have not taken over yet, so I may not be able to answer all of your questions. Hopefully in August, I will come on board full-time here in Decatur as your president of the hospital, and I look forward to it. I've already been amazed at your community, the wonderful outpouring love and support already, and I haven't even started, so thank you.
Thank you, Kelly.
Thank you.
Miss Judy, good morning.
Good morning, sir. Over the course of this weekend, I had to go to a central task force meeting regarding COVID. And I will confess to you, it was in kind of an out-of-the-way place, and in the process, quite honestly, I argued with my GPS and kind of got lost. And all of a sudden, I realized that I had made a wrong turn on a one-way street, the wrong way on a one-way street. And a very nice police officer decided to enlighten me on my error, but he was very nice. It was not Chief Allen, but he was a very nice police officer. And he said, "Ma'am, you're going the wrong way on a one-way street." And I said, "Yes, sir, I've kind of figured that out." And he said, that's what the signs are for. The signs are there to keep you safe, to keep you going in the right direction. And, failure to look at those signs will get you killed, will get you in trouble, get you devastated, get you killed. Folks, we're going the wrong way on a one-way street. Over the course of this weekend in our state, we increased over almost 5,000 cases. That is the wrong way on a one-way street. And we currently have over 1,000 deaths in this state. Now, to bring it more home, and I appreciate Kelly's numbers because that was tremendous. In the past 14 days, we've had 400 more cases in Morgan County, roughly 400 more cases, but 138 of those occurred in the last 3 days. We really had hoped that 4th of July weekend and the continued opening up would not have the impact that it did, but it looks like it's going to be pretty devastating, and we've got to there's nothing we can do about that now except learn from that experience and hope that it doesn't happen again. I will also say, and Kelly has already given you the numbers for the local hospital, which are tremendous, but we hit peaks in the state in people who were hospitalized over this past week. As a matter of fact, on Friday, we had the highest number of hospitalizations in the state that we've had since this started. And one of the points I want to make, and I do agree with Kelly tremendously, that, we do mourn for the deaths. We mourn for the deaths across the state, but it's not just the deaths. It's the people who have been in the hospitals. It's the people that have been sick. Some of these people have been tremendously, tremendously sick. You hear on the news folks that have been in the hospital for 42 days and 72 days. And I'll just be honest with you, you know, being on event's not a fun place to be. And being away from your family is not a fun place to be. One of the points that Kelly made, you know, in terms of the number of folks that are in the hospital, please remember that if we've got 26 in the hospital and 10 potentials, that's 36 folks who are there with beds. We've got other folks that are still sick with heart attacks, COPD, diabetes, cancer, many other things, and those people also need those beds. And as Kelly said, we're not in dire straits right now, but if we don't do something, we could be in dire straits. You know, when the hospital is stretched, it's not just the bed that's at risk, it's also the nursing staff who are stretched to the limits. They have families, they get exposed, hospital, all of these folks that Kelly mentioned, the custodians, you know, all of the other folks, they also play a tremendous role. Let me also say to you that our first responders in this county, the Department of Public Health notifies first responders of addresses so that they can provide protective equipment for their responders when they go into homes. Right now, we have over 600 addresses that your first responders are having to, you know, if they get a call from, they have to dock up in PPE. So the PPE is also another issue. And as Kelly and the mayor both said, we're in this, we're all in it together, but if we don't do something, we're going to go off of a cliff in that one-way street. And we really have got to do what we have to do. Now, the one place I would tell you not to go is to Florida. If you have not looked at the numbers in Florida, those of you who chose to spend the 4th of July in Florida probably wasn't the best idea. That being said, let me go back and say that testing is up hugely in everywhere. I mean, everywhere we're just having a tremendous number of tests. As a matter of fact, another place that's extremely strapped is those testing facilities that are running these tests. The Department of Public Health was able to give test results in like 24, 48 hours max. We're looking at that being pushed to 72 hours or maybe even more. A lot of the other labs are looking at, you know, difficulty with getting the test done. The bottom line to it is, and I go back and say something I said before, it's so much easier to stay out of trouble than it is to get out of it once you get in it. You know, regardless of where we are, we're somewhat in it. We've got to do what we've got to do to get out. And I, along with Kelly, want to commend this city. It was a tough decision. It was a tremendously tough decision. There's more tough decisions to come. But I commend this city for doing what it could do to take care of the people in this city. By the way, your neighbors are having a rough time too. If you look at the numbers in Madison County, you look at the numbers in Limestone County, you probably need to be like Dorothy and the Wizard of Oz. There's no place like home. There's no place like home. Thank you, and if you all have questions, I'm sure we'll both respond.
Thank you, Judy. I mean, your words of wisdom is always unmatched. They really are. Thank you, Kelly, also. As you see, we all are in agreement. We all agree that the mask ordinance is something that we need to do. Remember, we are all in this together. And when you look at it from a police perspective, I've been asked, the mayor's been asked numerous times, just how will we enforce this thing? We're looking at enforcing it kind of on a three-part type of system. The first thing we want to do is educate the public. We want to educate you on where you can wear the mask, where you should wear the mask, who should wear the mask, and the exemptions to the mask ordinance also. Once we educate you, you know, if it continues to go, we will give you a warning. So you need to have a mask on. From the warning, then we will give you a citation. As Judy mentioned, making of the ordinance was very difficult. We have people on both sides of it. We're not there to violate anyone's rights, civil liberty rights, or anything of that nature. Our goal right now is to protect and save lives and lower our numbers. This is unprecedented chartered times that we're in. We really haven't been through this at all. So do we have all the right answers? No, we don't. Are we doing some things and working it out as we go? Yes, we will. We will continue to do that in policing. We would treat this just like any other ordinance. And yes, I've been asked, well, how can you enforce this ordinance along with all the other ones? We're going to do the best that we can to enforce it. What we do not want you to do is sit outside in front of a store or business and call 911 and say a guy's walking into business without a mask on. That is something we do not want you to do. If you have a problem and you feel real uncomfortable, check with the store owners. Let the store owners contact the person and see if they need a mask, if they have the ability to have a mask, or if they meet one of the exemptions. So there's a lot of learning curve that we're going to go through with actually enforcing this ordinance. With that said, all our officers, matter of fact, you can get masks for those who don't have a mask from the fire departments, from City Hall, here at the police department, from our substation at the depot, and our officers are going to have some masks, extra masks in their vehicle, so that if you don't have one, we'll be able to provide one for you. That's pretty much what I have, and I'll take any questions that you all may have from this point on.
Have you given out signs to businesses to put on doors saying, you know, today at 5 o'clock from now or for the next 30 days, masks are required, anything like that?
No, the city don't give out signs like that to the businesses. The businesses can print their own signs up.
Have you recommended business owners to do that?
Yes, we did. We recommend that business owners place signs up on their stores, fronts, saying that there's a mask ordinance in place in the city of Decatur, and we ask that people follow the ordinance.
And if a business owner chooses not to enforce the mask ordinance, what happens?
If a business owner chooses not to enforce the order, there are several things that we can do. Remember the three-part phase that we want to go through. We want to first go through and educate them on the ordinance, actually give them a warning on it, and tell them the repercussions that can come from them not enforcing it, such as a loss of business license or something of that nature.
Questions for Kelly. Can you talked a little bit about how the hospital is, supporting this mask ordinance. Can you just talk about kind of the indirect but direct correlation with wearing a mask to in turn, trying to reduce those hospitalization numbers that we're seeing?
Yes, the mask itself protects your saliva from, going forward and infecting someone. And so really by people wearing the mask, we can keep down the spread. That's our whole goal, is to keep the spread. I don't know if I answered that correctly or not, but that's our goal.
What's your biggest concern right now, hospital-wise?
Hospital-wise, right now, we're having a hard time, I think Judy talked about this, getting the reagents that go in the lab equipment or when we send it out. So the response time on getting the positives back, that is the biggest issue we have today, and we're trying to work with Roche and all the other labs to get that reagent.
And if people do go and get tested, I guess, I know they're supposed to quarantine, but can you kind of talk more about that, stay at home until you get those results, even though they're taking longer than we thought they were going to take?
Yes, that's our thing. Please, when you feel like either you've been exposed or you're sick, please stay at home. And until you get the negative test back, we're actually requiring our employees to have 2 negatives so that we can really make sure they don't have it, kind of an extra step there. But yes, please stay at home so that you don't spread it.
Judy, a couple questions for you.
Sure.
We're going to start seeing those 4th of July numbers come in. What is your biggest concern with a potential spike in that?
Well, obviously, the things we've already talked about, and certainly increased number of people that are sick. And let me also add to that, a lot of our young people feel like it's an old people's disease and, okay, so they're going to get rid of us, and my children think they're going to collect an inheritance, which I've already spent, so it's not going to happen. They can get over it. But the reality to it is we are seeing younger and younger people have this disease. We're seeing younger and younger people get sick with the disease. The other thing is it would be a horror to me if I was a young person to know that I infected my mom or my grandmother or my granddad or whatever. And as has been said over and over again, we're all in this together. The other thing is these young people are our future. This is our world, our future, and we need their intelligence, we need their cooperation, we need them to be a part of this. So, certainly we need to all be well. And let me say, if this illness was something like Fifth disease, and we do have a few little viral infections that you're over in a day or two, and it's not a big deal, but this is not one of them. This is one of those that we've seen a lot of people get really, really sick for a long period of time. The other thing is we don't know what the long-range effects of this are going to be. And those people, let me say up front, who have gotten really ill and died, many of them have had ongoing lung situations, kidney situations, and those kind of things. We need these young people and all of our folks to be around to contribute to this city and to our state.
What are you hoping to see, maybe 2 weeks from now? The mask ordinance goes into effect tonight. Are you hoping to see those numbers decrease over the next couple weeks?
Well, I can't believe they'll decrease over the next couple of weeks. The incubation period is, we're seeing about 2 to 10 days from exposure. The ordinance goes into effect at 5 o'clock this afternoon, as I understand it. Now, the good news is we will be able to look at Madison County. Madison County implemented their ordinance last Tuesday. So in 2 weeks from Tuesday, we're really hoping to see a decline in that county, and we're hoping that we'll be right behind them. I support what Kelly said earlier also, in that we expect to see, and we certainly are hoping that the surrounding counties are going to take up the same battle that this city folks took up to say, hey, we're in this together and we're going to protect our people. If not, by doggies, we just won't let our people go to Huntsville to shop, will we? So we'll show them at the Limestone or wherever. Y'all need to stay in your own city and county and keep the viability of your city here. So.
Schools are set to make a plan next week for reopening. What are kind of your thoughts on, if the numbers hypothetical are what they are today, would you recommend kids to go back to school?
Well, let me give you the simplest answer I can and then elaborate a little bit. If it were my child, would I let that child go back to school? Knowing what I know that these schools have done, absolutely. Knowing what I know that these kids need far beyond. Well, first of all, let me also say the mayor and I will soon be in the home, and we really need these kids to know more about how to take care of things than just left to right and how to tie your shoes. We need them to be intelligent on Medicare, Medicaid benefits. We need them to be intelligent on all the things that are going on. Plus, these kids need socialization. They need to be with each other. There's so much that kids learn outside their home. I will say probably the most interesting thing that's going to happen is when they write their little essays. When I was young, the first thing you did was when you went back to school in the fall is you had your little essay on what I did this summer. Those should be really, really interesting. But I will say, on behalf of your schools, on behalf of your superintendents and folks, it is unreal the things that they are trying to do. First of all, they're giving families options. Do you want remote? Do you want in person? Do you want whatever? Which is wonderful. They're doing surveys. But listen, they're separating desks. They're buying equipment. They're getting masks. They're getting isolation rooms. The kind of the sad part of that is the cost. It is unreal that so much of the money that we should have spent, that we should be able to spend on paper and pencils and educational materials, schools are having to spend so our kids can have a safe education. But kudos for these folks for trying to do that. Would I send my child? Absolutely.
Are there any more questions? Okay, well, since there are no more questions, thank you, Judy. Your words of wisdom is always encouraging. It's very encouraging. Thank you, Kelly, and welcome to Decatur. And we look forward to working with you and having a long and prosperous career.
Thank you.
Since there are no more questions, our next press conference will be Monday, July 20th at 1 p.m. So we'll see you then. Thank you very much.
You don't have